Hello, my name is Jalisa Simpson. I will be doing my professional testimony video for NUR420 Nursing Policy. My focus is public health, which is defined as my definition, caring for the public by teaching, providing medical attention, and continuing to do research to find cures and discover more preventive options for diseases and disorders. My problem, I think that there should be a cap to healthcare costs and insurance. According to the Commonwealth Foundation, they did a survey on people that have medical bills, and out of the working Americans, 41%, which is equivalent to 72 million, either have medical bills or medical debt. This is up 7% since 2005, which was 34%. If we add in the 7 million of elderly, that puts us up to 72 million in the USA who is facing this. This doesn't even include the disabled who's unable to work and pay their medical bills. 2/3 of US adults under the age of 65 were faced with one of the three things. They went underinsured, uninsured, or did not seek care due to the costs. One thing I did research on as far as evidence-based is micro health insurance, and I'm focusing on this because I think that the goals that they accomplish with micro health insurance are the same goals that we can accomplish with putting a cap to what we charge the public for health insurance and medical expenses. Some of the goals they achieved were reducing the out-of-pocket health spending, decrease the amount of household borrowing because less people needed to borrow for medical expenses, and decrease of poverty because the amount of money people are getting debt over for medical expenses is putting them in poverty because they are not able to address other expenses like their household, food, clothes, other necessities. Lastly, the catastrophic health spending, and this is basically when their income is going about 40% or more of their income is going towards health spending. So they were able to decrease all of those things. As far as position, I am a nurse, and I see a lot of patients that come in with strokes and heart attacks and different diagnoses that could have been prevented, but they waited for care due to the cost, not wanting to pay out of pocket and have those bills, or even what insurance charges them. They didn't want to have to face that. I myself, last year, before I turned 26, I knew I had to choose between paying Cobra $1,000 a month or going without insurance. And what I did was I got while I was still on my parents' insurance, I addressed everything I needed for health-wise and waited till I became full-time in June and went without insurance rather than paying $1,000 a month for poor insurance. The impact of healthcare or healthcare delivery, it's like a cycle. When we teach our patients, we provide them with information and medications. If they don't have the funding to go and get the medications and follow the new diets and everything, they end up back in the hospital, usually for higher acuity, which means higher costs, which means more medical debt. So all in all, I believe that if we put a cap on the insurance and what we charge the public, we can overall improve health and save people a lot of money. Thank you.